Okay. Hi, everyone. We want to welcome you out to Recovery Business Association's first Zoom meeting. Our topic today is how to maintain best practices for a substance-free workplace. And we have Peter Brunzell with us today, who is the Executive Director and Founder of RBA. Hi, Peter.
Hello, all.
How are you feeling today?
Good.
Good.
The sun is out and the cold is starting to go away, so I'm excited about that.
Yes, spring is around the corner, which means new beginnings. We also have Rachael Cooper with us today. She's the Senior Program Manager for the National Safety Council, and she is our special speaker, and she's going to lead us on this topic, as well as Peter. And she's going to start and introduce herself and go over some really critical information, and Peter may be jumping in on the topic, and then we'll follow this up with a Q&A where all of our participants who are with us today can message us some of their questions and we will answer them for you. So take it away, Rachael.
Great. Thanks for the introduction and thanks for having me. So like we just said, we're going to talk today about, essentially substance use in the workplace, right? And what that looks like. And my job essentially at the National Safety Council is I run all initiatives related to substance use and mental health in the workplace. And what that really looks like is how do we ensure that employers can support their employees when they or a loved one are struggling with something related to substance use, mental health? And this is a really broad conversation, and certainly one that has been it's really just been highlighted and emphasized by the past 12 months with the COVID-19 pandemic and what people have gone through. So I'm going to just do a very brief overview here because we've just got a half hour today, but I do encourage y'all to check out anything you want to check out at nsc.org/opioids at work. And I'll repeat that again at the end. You can always get in contact with me as well. But the biggest take home point that, we really want to bring home is substance use can impact anyone, and anyone can be an employee. So 75% of people that have a diagnosed substance use disorder are in the workforce. And more than that, we're talking about people that have a diagnosed substance use disorder. We're not talking about people who recreationally use substances. So it's reasonable to assume that a lot of people who use substances are in the workforce. And my background is in harm reduction and needle exchange services and direct frontline opioid overdose prevention. And the vast majority of the people that I worked with were in the workforce. This is something that impacts on a multitude of different levels. Oftentimes with employers, we talk about a few different things. We talk about, how is it impacting your financials? And that, is relevant in a lot of ways, including things like, healthcare costs. If you provide employer-sponsored healthcare, then this obviously impacts lost time, turnover, that kind of stuff. It can impact the safety of your workplace. If you have people who are impaired on the job, that's obviously a safety risk, and safety is a critical concern. But most importantly, employees are the most important part of any organization as humans, right? We are our full selves, but that does not stop at the door. So when we talk about this with employers, when we talk about developing, what we're talking about best practices, what we're really talking about here is how do we support employees, period, right? And this goes for overarching health, mental health, physical health, substance use, et cetera. And there's a wide range of audiences that we always have to make sure that we engage in these conversations. We have to talk about leadership, because if you don't have leadership buy-in, it ain't going to work. We got to talk about HR, because even though policy is not, a sexy topic and it's tough to wrap our minds around, and often there's a lot of complicating factors as pertains to, federal, state, local regulation. If the policies don't match the passion that somebody has, it doesn't matter, right? People have to be able to take the time they have to take. They have to be able to do the things they need to do. HR needs to use non-stigmatizing language in their policies, for example. We need supervisors and managers to be engaged, because oftentimes supervisors and managers are the door to the organization for an employee, right? It's not HR. It's saying, I trust my supervisor, so I might go to them. And then last but not least, of course, we have to have employee buy-in, right? None of this works if employees don't trust their employers. And that is a two-way street. Trust has to be earned, and trust has to be something that is given and taken, and it is not necessarily an easy thing. So, when we look at this, and when we look at, best practice, when we talk about prevention, when we talk about supporting treatment and people in recovery, we're talking about all of those people needing to be aligned towards one goal, which is making sure that employees are safe in the workplace, they are mentally safe, and that they can get the support that they need for them and their loved ones. So that is my quick spiel. And I'm going to turn it over to Peter now to kind of do some framing over what we're going to talk about next. But I do encourage you all to come check out some of the further stuff we've got at nsc.org/opioids at work.
That's awesome. Thank you so much. One of the things I was thinking about when you were talking is these simple concepts of what we bring into the workplace, what Recovery Business Association does, what we're supporting, how we're going about doing that. And sometimes they seem like they are so simple that it's not that grand that you're like, oh yeah, that would work. So making a safe place in a work environment for people in recovery and having that being an ongoing space. Have you seen people utilize that process from the national safety standpoint in workplaces? Have you seen people doing that in the workplace? What's your experience with that?
Yeah, we certainly have. I think what most people do is, there's a lot of different, quote unquote recommendations out there, right? So for example, engage and educate employees is one that people feel pretty comfortable doing, because there's a lot of materials out there where you can, be it a poster or, for those of you who aren't super familiar with some of the manufacturing construction world, like a toolbox talk. So a 5-minute talk that a supervisor can read or can give. That's pre-written for them, so they don't have to come up with it themselves, right? Posters, maybe a blurb in the company newsletter or something like that. So the education and awareness piece is a space that we see a lot of movement in general. We also see that it's easier for people to for HR to kind of go through like their drug and alcohol policy or their benefits and from their perspective, make sure that things are covered. But what we also found out via a survey that we did a couple of years ago of some 500 plus employers looking at HR supervisors and safety professionals is that a lot of HR professionals, we don't really know what's covered in a lot of the in benefits, because and we asked why, why don't you know what's covered, and all of a sudden it's like, they don't know what right is in terms of treatment. They're like, okay, so if you think about what treatment is, most of this is what has been portrayed in the media, right? So it's mostly what's been portrayed in like, okay, detox or inpatient. And like, what does that actually mean? To a person who doesn't know, they're not going to know. So it's on us, people who like us at the National Safety Council, and Peter, you and your crew, like helping employers and benefits providers and the people who are selecting the plans to really negotiate for good terms and to understand what coverage actually means. So that's something that we also see people try to do, but it's certainly, that's one of those more complicated ones, and sometimes we'll see other things like, for example, not serving alcohol at work events or something like that. So very concrete, we're just not going to do it kinds of things. But that more thing, bringing your full self to work and helping employees feel safe, it is something that sounds more simple than it is. And it does require a lot of engagement across the board, especially with managers and supervisors, and making sure that they're, if you go to one manager once and you say that you've got something going on with substance use and you get a stigmatizing reaction, are you going to go back even at a different organization and say the same thing again? I don't know if you will.
That's a good point too. And then that's kind of part of that process too, of knowing that when you go to a supervisor, you're also exposing yourself. So that's that fear, right? So of losing your job or getting in trouble. And, that's one of those alternatives that I was going to bring up, is where Recovery Business Association comes in with giving that aspect of peer-to-peer approach from the outside. So there is no legality involved. It's completely confidential. Have you seen that kind of process work well in the work environment?
Yeah, we have. So there's a couple places in particular that have really implemented that well. One is Fishing Partnership Success Services, which has a lot of S sounds. Fishing Partnership Success Services out in the Massachusetts area. And they have a really different type of situation, because fishermen during the season will be out on boats for weeks at a time. And it is an industry that's been hit hard by substance use and by overdose. So this group Fishing Partnership Success Services has done a multi-pronged thing, and there's three main things. One has been they got all 80 plus of their boats trained and equipped with naloxone so that they have it on boat. So if there's a medical emergency out at sea, they can address the issue immediately, obviously, because if you are miles off the coast, it's a problem. They worked with treatment providers in the area so that their crew members and their team members could get extended scripts for buprenorphine and not methadone, but buprenorphine and some other anti-anxiety meds, et cetera, things that people were needing that they couldn't get filled fast enough or for a long enough period of time before going out on the boat, so that was able to happen. And then lastly, they did implement a peer support program, and that's what the bulk of their success has come from, has been that program, in terms of people who are they have it set up a few different ways. So it's been something that, I think would encourage you all to check out their model, just as something that it's been a multi-pronged thing, and they've had a lot of success with it, and also with their families, because this is a group that provides support for not only the fishermen or fisherwomen, but also their families as well. So it's been a really cool initiative. That's one of my favorite ones to talk about personally. We do see though that, a lot of places when we say peer support services, they're like, do they have to come from inside the organization? And the answer is no, they don't necessarily. Some people have done it that way. Sometimes if an organization has a champion, somebody high up, a VP of something, let's just say, that's like, this is my passion, and this is what I want to do. And I'm going to create this culture from the top down, where we talk about it and where we bring in people to talk about these things. Sometimes we see the peer support coming from inside the house, but oftentimes we're looking at a community organization that says, hey, I'm here, let's partner. Let's get this done for your employees as well.
And with that, that's kind of that cultural piece, right? So if you have somebody with passion on board and moving that forward, what happens when you don't have that passion internally? How can you still help create that culture? What have you seen?
So, first of all, I would say that a champion can also come from somebody who's an employee. It doesn't necessarily have to be that person, certainly easier, but what we see is a lot of it just has to do with that kind of quieter action type thing, right? So, when people look at the suite of recommendations, they can say, oh my gosh, there's so many things I need to do to make a difference. I can't do all of them. I think it's first important to realize that changing one thing or implementing one education program, or even providing, saying, okay, we don't have the time or space to do this right now. We're doing the best we can, but let's just get a list of places in our community that provide support that we'll put in the onboarding packet. Like, that can change somebody's life. So I think it's important to realize that it's not just, like the full, it's not the full thing that we all have to do. It doesn't mean you have to have the engagement for the VP. It doesn't mean that you have to change everything all at once, because that's really, as an employer, there are a lot of competing priorities. And especially with the past 12 months, this has certainly been something that has not been easy for employers to focus on. We've personally seen a much heavier focus on mental health recently than we have on substance use, for example. The data is obviously telling us that, overdoses are up and substance use is on the rise, but the immediate thing is employee mental health. Now, these two things are intertwined. They're not the same, but that's what we're seeing, right? So, even if you don't have a champion, those unsexy things like the benefits, right? Or trying to figure out what makes the most sense in terms of PTO policies. If you can't take time to attend an appointment of any type, you're scared of losing your job, you're going to have to keep your job. You're going to put your own health at risk. That's where most people are at these days. We have new data out, and that this just came out yesterday, actually. And so I thought it was, really interesting that 61% of adults reported difficulty paying for things over the past 7 days. 61%, which means that you can't take time off or risk losing your job, and we're looking at, 30% of people delayed medical care due to the pandemic and financial anxiety. Like, this is what we're seeing here. So how do we just increase access to care? We don't have to be the ones to give the care necessarily, because for one, I am not a diagnostician. I don't want my supervisors diagnosing people, right? I don't want that to happen. I want them to say, I know that you need support. Let me link you to support, right? Whatever that may be. And another one of those tools is, of course, employee assistance programs. If those are provided in a workplace, they are extraordinarily underutilized, in that most of the time employees don't A, know that they exist, or B, think that they're actually confidential. I'm not going to, if I'm going through my workplace and I have to tell them something that I'm worried about getting back to my workplace? Am I going to actually tell them what's real? Probably not. Again, to our earlier point, Peter.
And that's where, when I was wondering it too, when you were talking about the National Safety Council, you guys have a calculator on your website. So in all of this, the employers, obviously, especially with what's going on in the world right now, staring at the bottom line and saying, what can I do? What can I do? What can I do to support the bottom line? And when you look at that calculator, can you tell me more about how that plays into people's minds? You guys use it as a tool?
Yeah, so we use this as a hook, right? And by that I mean sometimes we all have to hook people into the conversation in different ways, because some people, for example, in that hypothetical world with the VP who's already really engaged, is this calculator going to tell them or convince them to address the problem? No, it's not, because they're already mentally there, right? But for people on the other hand who maybe they're just learning about it, what this calculator does is it takes your industry, your employee base size, and your state or states multiple, and it pulls together data from 2016 to 2019 that looks at what the rates of substance use. Much of this is based on statistics from the Bureau of Labor Statistics or the Department of Labor, crossed with healthcare cost statistics, crossed with the National Survey on Drug Use and Health. So the way that this all comes together is that it looks at what substance use costs your workplace. And we have to be careful with this. And I would advise everybody on the call and who's listening to this now and after, just be careful when you're doing this, because it does say that, hey, people who have a substance use disorder do cost your workforce more. And what we don't want is for then employers to say like, oh, then why are we even doing this? Because the second part of the conversation is people in recovery cost less than your general workforce. And I'm not talking about like people with a substance use disorder and they go into recovery and they cost less, because yes, that's the thing. Less being turnover, lost time, productivity, healthcare costs, etc. But what we're actually talking about here is saying, people in recovery actually incur less healthcare costs than people in the general population. How can we get people to recovery? You can save money by engaging these tools, by really working to support people that have a substance use disorder. You can save money by doing that. And that is one very small part of the puzzle, is this financial thing. And what I get nervous about personally, because this is just who I am as a person, is I don't want to monetize this conversation. I don't want to dehumanize it. It's important for employers to understand that there are financial benefits. But again, to my earlier point, employees are the backbone of your organization. They are the most important thing. If we don't have good employees, we don't have anything. Right? We all know that. we all work. We all know what it's like when you don't have good employees or when employees aren't doing their job. But, this is about saying, hey, we can support people through, and it's going to strengthen our workforce at the end. And I think that there's a lot of intangible things that are difficult to quantify in this conversation. When a workforce supports somebody and somebody supports a workforce, and what is that bond? What is that loyalty that comes into play there when people who have been through, when they have had to revamp their whole life, when they've had to pivot, when they've had to do all of these things, they know how to cope with stress, right? They know how to triage and focus and figure, hey, this is what we need to do to get the job done. And these are positive traits, but you can't quantify it. So, every time that I use the tool, I always marry it with something where we're talking about that human value, not just the financial part, but just the humanity of this issue.
And that's where I was wondering too, as far as like what we're talking about now and what we do with Recovery Business Association and what you guys do, you have different examples, right, in the world that you've seen organizations that have grabbed onto these tools, they've embraced them, they started utilizing them. You mentioned one with the fishermen, but do you have another one that just out of curiosity, some of the things and the outcome that you saw, some of the things they implemented and the outcomes that you saw from that, or that they saw?
Sure. So I'm going to do two examples, because one's with a big employer and one's with a small employer. And I think that these conversations vary, right? So with the big employer, I'm going to talk about Nationwide. So Nationwide is the Nationwide, Nationwide is on your side, And they have an extraordinary program internally for their employees. And what this has looked like is it's multi-pronged, right? So you may have heard of Belden, and it's simple. It's similar to that in that, if you have a positive drug screen, it's not automatically a cause for for termination, and a lot of places do that, but instead you have an option to go into treatment. And, it's, see, some people, of course, elect not to, right? Maybe they're not ready. Maybe they don't actually need treatment and they just did some nonsense on the weekend and they had a positive drug screen, and like sometimes that happens. But they bring people into treatment, and it's not that it's not like a 7-day detox followed by here's your script, go away. It's they figure out what's best for the employee, right? So they say, okay, we've got your medical expenses, you're not going to lose your job. Figure out what you need to do for treatment, and not only is your job there when you come back, but they put together employee resource groups to really do some of this supporting work as well. And the other thing is that they recognize the concerns that people have about confidentiality and anonymity. So what they did is they brought in, they built this portal where you could access the information needed about benefits, about the EAP, about these things outside of the company intranet. So nobody's tracking it. So it's very explicitly, it says, this is not something that we track. So go use it. We don't need to know that you're using it. We just want it to be there. Right. So again, to address those kinds of, those anonymous concerns. And they've also done a lot of work with, making sure that employees' families are engaged with take-home things, so and stories of hope and success. And so that's a big world example of one, somebody who has tens of thousands of employees and who can kind of devote an entire team to creating these tools, and then on a smaller level, go ahead.
Just a quick note. Yeah. I would imagine such a big company is also then tracking, not to go back to financial changes, but you can't be in business without watching that. So did they report any, just in a general way, their financial changes and how they're structured? Did they show?
No, I mean, not publicly, but so anecdotally, they're happy with how things are going. So my guess is that's part of the conversation. But I think if you look at healthcare costs, and for those of y'all who exist in the benefits world, I'm going to get the acronym wrong, so I'm going to come back to that because it's going to permeate. But you can request to see exactly how much your healthcare plan is spending on preventing and treating substance use disorders in terms of, for example, screening, and then also, obviously prescriptions for, whatever it is that's covered, right? And again, we want coverage to be broad. It's not always broad, but you can see what they've done. And part of the cool thing with the substance use cost calculator that we already talked about is you can kind of compare and say, wow, my baseline is really low in comparison to others in my state. Like, what's the deal with that? Like, if I'm a construction company and I've got 100 employees and I'm in Wisconsin, and they're saying that my healthcare costs should be this, and instead they are so much higher, then what's the deal? Where's the gap here? Let's talk about this. Let's figure it out. So that's one of the cool things that I like about this tool too, is because like healthcare coverage is extraordinarily important. We live in a country where employer-sponsored healthcare is what a lot of people have to work with, right? So it's important that we get it right, regardless of broader conversations about healthcare in this country. For the employers, it's important that we get it right.
And you mentioned the smaller one.
Oh yes, the smaller one. I was like, what was I going to talk about? I could not remember. One of the smaller ones that we've heard of, some success, and this is actually one that does engage with the construction conversation. Construction being a fairly hard hit industry, in general. One of the things that there's an organization called Keystone Contractors out in Pennsylvania, and they're contractors. So they have a totally different structure, but they don't have is a central organization space, right? When people are going out to sites, right? It's not like you have a break room where everybody's sitting in the break room and you can see the poster about the thing. So they've had to get real creative with how they're communicating this. And it's something that what we've learned is that they were able to get like these little stickers that they were able to put on their insurance cards about asking about their doctors about what they're being prescribed. And we know that for the prescribing patterns, we're obviously one part of a much larger conversation, but it is important in an industry where you do have a lot of people who sustain a high rate of injury in comparison to other industries, right? So this is a really good example of how, they had these little warn me labels is what they're called. And they're just going on an insurance card and they just help people ask the questions, a lot of us don't know how to ask questions from our doctors, and that's okay. It's just where we're at. But what that turned into was this larger thing where now the last week in Pennsylvania is now they went through their state legislature, and it is now, it's now it's like the state awareness week for opioid use in construction. So it turned into this much larger thing where they were able to take this little thing, and a toolbox talk, and it grew because it was having those kinds of impact, and people were able to have the conversations. And I will say that, one of the other impacts that we've seen there, and that has kind of grown beyond, this initial push in like 2018, I think it was over the past year, these are the same people that have been able to have really vulnerable conversations during the pandemic about suicide and mental health, because they started this conversation years ago. So it builds on itself, and it was one person who felt really strongly that they should do something. That's how this whole thing started. And they took it to their workplace, which is not a big workplace. It's a small workplace, and that's how this started. And now they've got, last week of July every year is the awareness weekend for the state of Pennsylvania about this problem in the construction industry. So, that's a pretty good example of how this can this can grow.
That's amazing. We are hitting our time. So we've gotten here quicker than I thought we would, but I just wanted to thank you, Rachael.
Thank you.
Joining us today, Rachael Cooper. She's from the National Safety Council, Senior Advisor. And if you have any additional questions, feel free to reach out to us at hello@recoverybusinessassociation.org. We'd be glad to forward those questions to Rachael or help answer them ourselves. And thanks for joining us today.
Thanks for having me.
Thank you all.
Thanks, everyone.